Good morning, everyone, and welcome to the HeartLife Foundation's first annual HeartLife Patient Education Day. Thank you so much for joining. We're really excited to have you all with us today. Marc, Bains, and myself, Jillian Code, we will be your hosts for the day. But before we get started, I would like to acknowledge the land on which I work and play and live is on the unceded traditional territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And I encourage each of you to think about the land in which you live and work and the territories of the First Peoples who are a part of that land. First, I also want to thank our sponsors for helping make this day possible. Everybody has been extremely patient. We originally planned to have this as a face-to-face, a hybrid event, but since we've had to transition online, everything is slightly different, but actually, I believe, somewhat better. We also want to thank Canadian Heart Failure Society, our physician organization, for supporting us through this event, and it is completely driven by us, the patients, and the family carers. So everything today will be focused on patient and family carers. So just a little bit of housekeeping first is that everybody is entered, excuse me 1 second. This is our agenda for the day. So we have a number of things happening throughout the day, going from 10 a.m. Eastern till about 2 p.m. Eastern time. We have a brief introduction from Marc and myself, and then we have our first patient workshop at 10:15 with Dr. Colleen Cannon, and then we are going to take a break, and then we have our second workshop excuse me, at 11:15 with Gordon and Karen on cardiac rehab, and then we have another break, and then we have our joint session with the Heart and Stroke Foundation on supporting the psychosocial needs and the heart-brain connection with Cindy and myself. So just to let you know that the session, the entirety of today is going to be recorded, and it will be made available to you through the HeartLife website and our YouTube channel. And since you have registered, it will be sent directly to you via email as well with a link to access it. And there's the information, our HeartLife website, as well as a quick link to our YouTube channel as well. So we do want this day to be interactive. So as participants, you are attending in audio only mode. So you can hear us, you can also see us, but we can't hear or see you. But we would like you to use the Q&A feature. So if you have any questions, please click on the QA icon below, as indicated by the red arrow, and submit your questions that way. And we will make sure that our panel of experts will answer your questions. And if we have more than one person during the session, if you could make sure to direct your question. Also on social media, if you want to follow us on social media, we will be live tweeting throughout the day at #HeartLifeDay, and you can follow us on Twitter at HeartLife Canada. So we are the HeartLife Foundation, and I'm going to hand it over to Marc Bains to kick us off. Marc?
Yeah. Thank you so much, Jillian. Thank you, everyone, for joining us today. This is a very exciting and unique opportunity for us to really present and share our stories, as well as develop these workshops for all Canadians, no matter where you live. Usually when we're in a physical workshop, we're restricted by the numbers, but today we're able to share with all of you. So thank you so much for being here, because without you folks, we couldn't be here at all. And so just briefly, before we get into our sessions, I will tell you a little bit about Jillian and I, our stories, talk to you about the HeartLife Foundation itself, and how you can get involved. Jillian, you'll have to switch the slides, so I think you have full control access, as you always do. You can jump right to that pretty picture of us on slide 5 there, I think. So just a brief background of myself. I was diagnosed with heart failure in 2008 at the age of 23. I know you're thinking, wow, he had a lot more hair at the age of 23. I mean, he must be, what, only 34 now, 35. But I assure you it'll grow back. I lived through heart failure for about 10 years prior to getting my transplant in 2008. And Jillian and I actually met in 2016. Before I get into our story of how we met and how the HeartLife Foundation was started, I'll let Jillian just share her story briefly.
Thank you, Marc. First of all, I want to say happy birthday. You're old and gray now at the ripe old age of 35 years old.
Yeah,
so,
thank you. Thank you.
So what a great way to celebrate your birthday, right?
Yeah, hey, we have with 111 people. I mean, this is the biggest birthday I've ever had.
Yeah, the biggest party ever. Thank you for passing that back. I'm Jillian, and I was diagnosed with heart failure at the age of 27. I have lived with heart failure for 15 years. I am 40, oh, how old am I? I'm 43 now. And I had a heart transplant when I was 38, and I had a second heart transplant 2 years ago, this past January. So it's been quite an experience. But as Marc said, there's reasons why we've come together and made HeartLife a reality. Back to you, Marc.
Thank you so much. So Jillian and I first met in 2016 at a Heart and Stroke Foundation roundtable on the burden of heart failure. We were both invited independently. We had not met before that. And I remember clearly the moment when we connected. We were sitting across the table and a screen came up, and it said 600,000 Canadians are living with heart failure, and over 1 million people are affected by the disease. We both looked at each other and we said, wow. And we're only 2 patients at this table of healthcare and industry professionals. Why is there not something being done from the patient-focused perspective? And so that evening, along with our medical director, our friend, and our cardiologist, Dr. Sean Varani, sat in the lobby of the hotel and said, why don't we do something? Little did we know, 4 years from now, we would have the HeartLife Foundation with members and champions across the country, and really creating a strong advocacy for Canadians living with heart failure. And so those were our beginnings, and here we are, happy to say we went from 2 individuals to now being part of the official agenda of the Canadian Heart Failure Society Heart Failure Update. And so I'll tell you a little bit about what the HeartLife Foundation does. Our mission, as you can see on the slide, we aim to empower patient voices through conversation, through providing access to innovative research, through medications, through cardiac rehab, psychosocial support, and ultimately improving patient care and care ability and quality of life through heart failure awareness. And a few of our pillars as we go through them. First one is generally advocacy. So on a broad level, we are creating awareness. So we want to raise the public awareness on what heart failure is, who it affects, and how we can improve care. And we work with multiple partners, healthcare professionals, governments, and policy, as well as patients and carers, because we want to understand your needs, your objectives, and how we can improve care for you. A few of the things, I mean, we're fortunate that we're in the Canadian Journal of Cardiology, the first ever heart failure focus group to be published in that. Let's go ahead. Jillian, an amazing patient perspective in the JACC. So if you, and all this will be shared with you. So I highly recommend after the session that we can go through this.
Yes. One of the things we wanted to really make sure, is that everybody's voices are being heard. And one of the things that we know well is that we need to hit the physicians where they're at, and reach them where they're at, so that they can begin to understand what it's like for us as patients and family carers.
Yeah, no, thank you, Jillian. You're exactly right there. I mean, because when we work with multi-stakeholder parties, and everyone gets an understanding of the patient and carer perspective. Our next pillar is innovation, where we collaborate with multiple stakeholders to ensure patient access to not only the latest resources, but innovative research, therapies such as medications and technologies. Some of our partners include Telestech for Home project, where we bring remote monitoring into the home. We partner with industry groups such as Canadian Heart Failure Society, Canadian Cardiovascular Society, the Heart and Stroke Foundation, as well as industry partners to help push the agenda. Empowerment. We believe that an educated patient and carer is an empowered patient and carer. And when an individual is empowered, they're able to effectively self-manage their disease and not only advocate for themselves, but other individuals around them. Next slide, please. A few of the ways we do that is to run campaigns, both locally, nationally, and globally. One of the campaigns we ran was Faces of Heart Failure. This campaign was really to generate awareness around what heart failure is. What does it look like? And there was no clear answer. As you can see from this image, you look at Antonella, 37, you look at Sunny, diagnosed at 18, Sharon, diagnosed at 64. There is no clear image of what heart failure is. And that's one of the key messages we want to emphasize as a foundation. We hold workshops and engagement like this virtual workshop, but also in person. This workshop was held last year, where we brought in Canadians from across the country, and we looked at what their needs were, what their gaps in care were across the care continuum. And now we're looking at developing solutions, actual hard resources, policies, where we can fulfill those gaps and create a better expectation of care. And then a lot of the work, as we can see, we do on the global stage. So not only do we present what we do, so Faces of Heart Failure, for instance, will be going global this year, but we look at best practices from around the world, bring them to Canada and see what we can implement. On coaching side, this one's quite important to us. On the coaching side, and I'll speed it up because I know we're getting short for time, we have mentorship programs online and in person, where you can sign up to be a mentor or mentee and support others that are maybe in your position, or someone that's maybe newly diagnosed or has some questions. Our HeartLife group is here. As you can see, I would highly recommend going to facebook.com/group/HeartLife Canada. A lot of you who have signed up for this session have already signed up, so fantastic. We look forward to seeing you there. And getting involved. There are multiple ways you can get involved. You can spread the word, of course, talk to other patients and carers, talk to your healthcare professionals, let them know who we are, what we do. You can go online to our social channels. We're always on there and active. Join our initiatives. We have local, regional, national initiatives that we're always wanting champions for to join. Connect locally, hold a local workshop if you want, and HeartLife Foundation will be here to support you. And then bring your skills. Jerry here, who's our Quebec champion. I'm not sure if he's on the line. He's a line dancing champion. We actually did a live achy breaky heart line dance. Yeah, it was fantastic. In front of all the physicians at the last update. And runs a fundraiser every year. And so just on that note, I just want to thank you all again for being here. Jillian and I are so grateful to have you. Without your voice, we don't have a voice. And we can't do this without you. And we look forward to working with you going forward. And I'm really looking forward to the sessions coming up. and I'm sure you'll enjoy them as well. Thank you so much.
Absolutely. Thank you so much, Marc. And we do need your voice. So please join us on Facebook. Go to our website and sign up for our email list so that we can make sure that all of the information from today, but also moving forward, that you have easy access to it. And if there's opportunities in your area or opportunities for you to engage nationally, people have been coming to us, the physicians, the industry partners across the board to really, because the need for the patient voice is there, and so we really need you to join us.